Welcome to Don't Take This, your go-to channel for clear, practical information about medication. Today we're going to talk about a medication you've probably heard a ton about, Tirzepatide. Yeah, you've probably seen the names Mounjaro or Zepbound popping up everywhere. Well, they're both brand names for the exact same drug, Tirzepatide. In this explainer, we're going to break down what it is, who it's for, and how it works, all based on the official clinical standards. But before we dive into what Tirzepatide actually does, we first have to understand the why. What's the problem it was designed to fix in the first place?
And that problem is this really complex, and let's be honest, often super frustrating relationship between managing your weight and managing your blood sugar.
Okay, this is a really important point. Major health organizations like the American Diabetes Association are completely reframing how we talk about this. They define obesity not as some kind of lifestyle choice, but as a chronic, often relapsing disease. That's a huge shift in thinking. It means treating it like any other long-term medical condition, like high blood pressure.
In this slide right here, it just nails the core challenge. Obesity is a major driver of type 2 diabetes. But here's the really cruel twist. Some of the older medications for diabetes can actually make you gain weight. It traps people in this vicious cycle that makes managing everything incredibly difficult.
So, how do doctors try to help patients break that cycle? Let's open up the treatment toolbox and see what's inside.
So treatment usually follows a few steps. It all starts with the foundation, lifestyle and behavioral therapy, diet and exercise. The next level up is pharmacotherapy, which is just a fancy word for medication. And that's exactly where drugs like Tirzepatide fit in. Then, for some people, metabolic surgery is also a powerful option. Doctors often mix and match these strategies to fit the individual.
All right, now let's zoom in on that pharmacotherapy step, because we're going to look at this powerful new tool that is really changing the game. So Tirzepatide is what's called a dual GIP and GLP-1 receptor agonist. I know, that is a mouthful, but the idea is actually pretty simple. Your body naturally makes hormones that do two things: tell your brain you're full and help regulate your blood sugar. This medicine basically mimics two of those key hormones, GIP and GLP-1. It's like sending a much stronger signal to your body's control center to manage energy and appetite better. And the key thing here is that Tirzepatide is the very first approved drug that works this way. This unique double action is what makes it such an effective option, especially for people who are dealing with both obesity and type 2 diabetes at the same time.
And the clinical data? Well, it's pretty wild. This chart is from a major study showing the average weight loss for people with type 2 diabetes over 72 weeks. The folks on the placebo lost about 3% of their body weight. But look at the Tirzepatide groups. They lost between almost 13% and nearly 15%. That is a game-changing difference.
But of course, with any medication that's this effective, there's a trade-off. It's absolutely essential to balance those amazing results with the potential risks and side effects. On one side of the scale, the benefits are really impressive. And we're talking about more than just weight loss. Studies show big improvements in blood sugar, blood pressure, cholesterol, even a lower risk of major heart problems. But on the other side, the side effects can be pretty tough, with the most common ones being stomach issues like nausea, vomiting, and diarrhea, especially when you first start taking it. And it's not just about stomach upset. There are some really important safety warnings to be aware of. Tirzepatide has a boxed warning. That's the FDA's most serious kind, for a potential risk of thyroid C-cell tumors, something that was seen in animal studies. For this reason, it's not for people with a personal or family history of certain thyroid cancers. It can also make oral birth control less effective and carries risks for other serious issues like pancreatitis.
So all of this really brings us to the big picture. And this is probably the most critical takeaway about using a medication like Tirzepatide.
This quote gets right to the heart of it. The clinical trials are crystal clear. If you stop taking the medication, you are very likely to regain half to two-thirds of the weight you lost within a year. And all those great health benefits, like better blood pressure, they reverse too. This brings us right back to where we started, that core concept. Obesity is a chronic disease. Think of it like this. You wouldn't take a blood pressure pill for a few months and expect to be cured forever, right? It's the same idea here. These medications aren't a short-term fix. They're a long-term management strategy designed to be used for the long haul to maintain their benefits.
And that really leaves us with a big question to think about. As these powerful new treatments for chronic conditions become more common, they kind of force us to rethink our goals. How should we, as patients, as doctors, as a whole society, define what long-term success really looks like? It's a fascinating question to chew on as the world of medicine keeps evolving.